Next up, we have Anna Morales. She is a genetic counselor and implementation specialist and associate professor at Geisinger. And she has 20 years experience advancing the cardiovascular genome. And she's joined our board back in March, and we're so excited to have her and her expertise. She's been a wonderful addition.
Thank you, Becky, for the introduction. And to the Gracianos for having me join tonight to talk with you about genetics and cardiomyopathy. What I would like to do is tell you a story about how genetics opens up an incredible opportunity for all of us through the DCM Foundation to be able to change what we know about basic science into hope and action. And to know what's at stake, let's start with how common this is. As many as 1 in 250 people have cardiomyopathy. That's millions, literally millions of people. And many don't even know they have it. Imagine a healthy 35-year-old, runs 5Ks, coaches soccer, tucks in his kids at night, and then one day his heart just stops. No warning. That's cardiomyopathy. And it really doesn't discriminate. Every family that I have met that have been touched by cardiomyopathy has the same exact question. How come we didn't see this coming? And what most people don't realize, as you have heard already tonight, cardiomyopathy has a very strong genetic basis. And that means that family members of affected people are at up to 50% risk of also having cardiomyopathy. You can have cardiomyopathy when your family history is positive, but also when your family history is negative. And this is important to understand because that means that cardiomyopathy can be genetic, even if the family history is negative. That means that there are families like this one right here, negative family history, where the risk is being passed down generation after generation in what can be, thought of as an invisible risk. And here is exactly where we can have science turned into hope. By now, and Ray showed this already, we know what the cardiomyopathy genes are. We know their names. And we have also learned that a substantial proportion of those genes, those in the middle of the diagram, are associated with a significant risk for dangerous arrhythmias. And the good thing is that today we can detect those risks. We can detect those risks early through genetic testing in people with cardiomyopathy, but also in people without cardiomyopathy. And that's the work that we have ahead. The guidelines say that we should be considering genetic testing. And we have been saying this since 2009. That's decades ago. And these guidelines have been updated throughout the years, most recently in 2022. Genetic testing is recommended for people with cardiomyopathy. And why is that? Because genetic testing has clinical utility. This is data from my collaboration with a group of cardiologists who are experts in genetic testing. And for this study, what we did was actually quite simple. We wanted to look at what real cardiologists were doing when they used genetic information in real patients. And these are our results. They show that for these genes right here in the different colored boxes, all of them associated with arrhythmia, genetic testing, positive or not, made changes to care. These cardiologists reported that with genetic information, they were able to consider new cardiac procedures, better management for medications, new cardiac evaluations, MRIs, for example, better lifestyle management. And for patients, referrals to specialists and clinical trials. So genetic testing can change the management of affected patients. And then for the patient's family, they were able to recommend additional testing. So this is a clear example of how genetic testing, genetics knowledge, basic science can be turned into real action. And what I'm showing here is the family part, how one single diagnosis can lead to referrals for genetic testing for an entire family tree. So let's see this woman right here, 37 years old. She lives in Oregon, and she tested positive. Now, genetic testing is indicated for her family members, and we start with her close relatives. Some of them live in Virginia, as you can see, and these red lines indicate a test that was done. And then each one of these arrows, the yellow, the green, the blue, across states, across generations, represents a new wave of tests. This is what we call cascade genetic testing. It's a very powerful way to diagnose cardiomyopathy early and also protect an entire family tree. So I hope I was able to demonstrate that genetic testing has utility in affected patients and in their family members. And this is quite important because we are moving towards a future of precision medicine, where, like we're showing here in this illustration, when we limit cardiology care to just signs and symptoms-based management, yeah, some patients will benefit, then others will not. Instead of what we see on the far right, when we use genetic information for the benefit of every patient, we can offer genetics-informed care. And this is the future that we would like to see what the DCM Foundation is working for. So the next logical question is, how close are we to this future? And what I'm showing here is that despite all these expert recommendations that I showed you already that have been around for decades, only 1% of people currently have genetic testing. And this is the result of our collaboration with the United Healthcare, Medicare, and commercial claims database, showing that we have a lot of work to do, bottom line. And again, we have the power to make it change. And I don't think that the problem is with the basic science. Basic science has come so far. We showed you. We understand how cardiomyopathy works, how it causes disease. We know the genes. We have the tools. We have the guidelines. A significant part of the problem is that awareness hasn't caught up. So if we work towards increasing awareness to move guidelines into action, we can empower families and we can actually engineer hope. So what do we need to do? We need to raise awareness. Early genetic diagnosis is key. The DCM Foundation is working every day and night to deliver this message to the public. We really have to engineer out luck. I don't think that outcomes should be given to chance. We are able to make outcomes predictable, especially if we use genetic information. And I'm a genetic counselor. Counselors are all about relationships and empowering people. And this is why we think that building programs that foster human connection is important, because I have learned that relationships drive resilience, especially in this field where patients have been neglected or invisible with their own disease and their family members' risk. And, I hope it's obvious to you by now why this matters. And it is because I have also learned through my career that people have more control than they know. And that drives engagement, and engagement drives better outcomes. And the DCM Foundation is here to drive that engagement and improve outcomes of patients and their families. I want to thank you again for the invitation. It's been a privilege to serve the DCM Foundation in their mission, and I hope that you consider donating tonight. Thank you.